Afternoon, everyone. My name is Alicia Rice, and I'm on the training and education team here at MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series. This is one of the components of our tobacco treatment and prevention education and training program, which is sponsored by and brought to you on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. This webinar will be recorded and posted to our website following the presentation. We are offering one continuing medical education credit and one CHES credit for this webinar, which will be sent to those who attend the entire session. In order to claim CMEs, you must have a profile in Cloud CME. If you already do, you will find your credits in your profile within a week of this event. If you do not have a profile in Cloud CME, you can find instructions on how to make a profile in the post-webinar email. For those that are collecting CHES credit, record of your attendance will be sent to NCHEC after the event. Only those who registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive CMEs and CEUs, as we are required to verify those who attended. At the conclusion of today's webinar, an evaluation will appear on your screen, as well as be sent to you via email within 24 hours after the event. We do encourage you to take the time to provide your feedback. It's not only helpful for us in planning our webinar series, but to our presenter as well. Today's webinar is titled Health at Risk, the long-lasting effects of tobacco and nicotine use, and is presented by Derek Bowen of MaineHealth. Derek Bowen has experience as a specialist health educator facilitating evidence-based programs within the community, including the Freedom from Smoking program. Derek completed his bachelor's degree in community health education in December of 2020 at the University of Maine at Farmington, and is currently pursuing the National Certificate in Tobacco Treatment Practice. Derek joined the CTI training and education team in July of 2023 as a tobacco treatment and prevention educator. Before we begin, just want to mention that all phone lines have been automatically muted to help reduce background noise. We do, however, want you to participate in the session. So please feel free to type any questions you may have during the presentation into the Q&A box, and we will address them as time allows at the end of the webinar. For your convenience, a copy of this presentation will also be sent out via email following the webinar. At this point, I'd like to turn it over to Derek.
Perfect. Thank you, Alicia. And good afternoon, everybody. Again, my name's Derek Bowen, and I'll be leading you through this webinar today. So for today's subject, we're going to be discussing the long-lasting effects of tobacco and nicotine use for both people who do smoke as well as those who do not use a tobacco product. But before we get started into that, I'm just going to be sharing a quick acknowledgement with all of you, as you can see on this slide here. And so I do want to mention that references to tobacco in this presentation refer to the commercial tobacco use and not the sacred and traditional tobacco use by Indigenous communities. All right, so now we're going to jump right into things and go over our objectives for today. And so I'll just go over these really quickly here. We'll start by introducing tobacco and nicotine products, including different types, usages. We'll then analyze some statistics and comparisons across the state of Maine, discuss the prevalence of tobacco and nicotine use in local communities. We'll examine adverse health effects due to tobacco and nicotine product use, review the impact of secondhand and third-hand smoke exposure, share resources and support options, and then we will also facilitate any takeaways and reflections towards the end. And so starting with combustible tobacco products. Um, this can include things such as cigarettes, cigars, cigarillos, pipes, roll-your-owns, and hookah. Combustible tobacco products are defined as tobacco products that physically burn the tobacco when using the product, which can then increase the health risk to the user. Combustible tobacco is by far the most dangerous form of tobacco use and also the leading cause of death and illness. Um, some of these tobacco products have different risk, but of course, there is no safe form of tobacco use. And that is one thing I do want to emphasize because no matter the product, how you use it, how long you have used it, there is going to be a list of negative health effects, which we'll be getting to later on in this webinar. I also want to quickly go over smokeless tobacco products. And there are a few different forms. So we have chewing tobacco, snuff, dip, and then a newer product called snus. These products deliver very high levels of nicotine and are considered highly addictive. However, the risks are different than those combustible tobacco products. As a whole, generally, they are somewhat lower, but they are still harmful and can cause illness and deaths. So starting with snus, this is a moist powder tobacco product originated in Sweden. The sale of snus is illegal in all the European Union countries except for Sweden. And snus has been growing in popularity pretty quickly here in the US. It has been promoted as a safe alternative to smoking and other smokeless tobacco products. However, that is not the case. And what these products all have in common, it is a product, of course, that is not burned, so it's not a combustible product, and rather it is used orally. It's parked into the tobacco user's mouth, which can then bring a whole different type of health risk in terms to the user's oral health, which again, touch more on that in a few slides. We also have heated tobacco products. So these are also non-combustible devices, and these heat the leaf tobacco electronically to produce an inhalable aerosol instead of burning tobacco to create smoke. The aerosol contains nicotine and many of the same chemicals found in tobacco smoke, just at slightly lower levels. So IQOs, those are manufactured by Philip Morris International and their U.S. corporation Altria. In 2021, the FDA authorized Philip Morris products to market IQOs as devices as a modified risk tobacco product. They are not deemed to be safe and they are not FDA approved. The U.S. International Trade Commission has ruled the sale of IQOs to be stopped because of a patent dispute between Philip Morris and R.J. Reynolds. And then another one we have here, a more recent emerging product in the tobacco and nicotine market has been vapes and e-cigarettes. And then even more recently, we've started to see nicotine pouches, which have drastically increased in popularity as well. And here's some very basic info about vapes, which are most commonly used nicotine products by teens and youth in our country. Vapes come in all sorts of sizes, shapes, and colors. There are hundreds of different brands, flavors, different types of looks and styles. And vapes essentially deliver nicotine by heating the liquid chemicals and creating a vapor that the vape user then breathes into their lungs. And there's two different main kinds of vapes. We have refillable and then disposable. Some of the most popular brands of refillable vapes are Vaporesso, Smock, and U Well. And then these refillable ones, they're essentially a rechargeable vape device that the user manually fills with an e-liquid, also called vape juice. And the vape usually comes with some sort of USB charger in the package. So when the battery becomes low, they simply just plug it in as you would, with your cell phone or a different electronic device to charge it back up. And when they run out of vape juice in that device, it's just simply replaced with a new packet of that juice. And then we also have those disposable vapes. Some of the more popular brands are Elf Bar, Escobar, Views, Juul, and Mr. Fogg. Like the name suggests, these devices are simply just thrown away once they're empty, once they've been used. Vape devices are constantly evolving, and the styles are always changing in order to kind of evade and avoid the rules and regulations that are trying to curb these products. And for that reason alone, as well with them being a newer product, it's really hard for us to keep up to date with all of the new products, new information that's going to be available too. But just these new products are just constantly popping up in stores and then also online as well, and it's really hard to keep track. And so now we are going to switch gears a little bit now that we've gone over the different devices and products, and discuss the prevalence of tobacco and nicotine product use and why it's so important to know the negative health effects of these products. And we're going to start just by taking a look at some facts and statistics. Hard facts about the prevalence of tobacco use and its toll on human life. Essentially, tobacco is the deadliest epidemic, both in the US and around the world. Tobacco use is the leading preventable cause of death in the United States. More than 16 million Americans suffer from smoking-related diseases, and half of all individuals that smoke will die an average of 10 years earlier than those who do not. And as you can see here on the screen, I'm going to be asking you a question. I'm just going to pause for a moment so you can all reflect. How many people die from smoking-related diseases in the US every year? So go ahead just to yourself, just come up with a guess, and I'll give you all a second. And again, that question was how many people die from smoking-related diseases in the US every year? And the answer, again, I hinted at the picture earlier, but that is a photograph of Miami, Florida, and the population is right around 483,000. And that's just about the same number every year. That's how many people die from smoking-related diseases in the US. And that's one of the main reasons why we're so committed to the cause of tobacco prevention and treatment. And then, as we can see on this, I'll show in a second the next slide, but another question is, how many people die from smoking every year globally, so across the world? And I'll move to my next slide here. And that's, as you can see, the answer is 8 million deaths every year due to smoking, including 1.2 million of those come from those who do not smoke, so non-smokers who die each year from secondhand smoke. And so 8 million people, that's roughly the entire population of New York City dying from smoking every year. There are over a billion individuals that smoke in the world, and that number has been increasing. And the World Health Organization has detailed information and statistics on almost every country in the world. We do also have a webinar highlighting global impacts of tobacco use on our website if you're interested in learning a little bit more about this subject in particular. Another quick comparison here. As you can see on the screen, there's a couple different pictures of Fenway Park, which is where the Boston Red Sox play their games. And as you can see, their stadium can hold a maximum of 37,731 people. And so now we're going to relate this to tobacco-related deaths in the US in a single month. So more people are dying every month from tobacco-related disease than a sellout crowd at Fenway Park. So the amount of people dying to tobacco-related deaths in the US every month would not fit in the stadium essentially because it's over 40,000 people lost every month. And this is a very alarming statistic, and it's important relating these to today's topics because those 40,000 plus people a month are dying due to these negative health effects due to their smoking and tobacco product use. And just a couple more quick facts here for you all. Relating to Maine here. So adults in Maine who die each year from smoking is right around 2,400. And then 27,000 youth, so those under 18 alive in Maine, will ultimately die prematurely from smoking. And then youth under 18 who try smoking for the first time each year, that is right around 2,500 for the state of Maine as well. And so, powerful comparison that brings home how huge the health burden of tobacco use is. More people die in the US each year from smoking than from alcohol, drugs, suicide, homicide, and motor vehicle accidents combined with one another. So nearly 500,000 people in the US die from tobacco use every year. So very alarming numbers. And now these next three slides I have for you all is just some data graphs and statistics that were found on the 2022 National Health Interview Survey. And I'm just going to take a few moments on each to explain what we're looking at and why it's important. I'm not going to dive too deep into it right now because you'll all get a copy of these slides if you want to take a closer look, but I will make some main points here. And so this first graph, we are looking at the prevalence of tobacco product use among adults in the US daily, or at least somewhat regularly. And as you can see, 19.8% of adults use a tobacco product. So that's just about 1 in 5 adults. Then we can see the graph is showing what these 19.8% of people choose as their tobacco product. And so that's that blue bar there. That's our 19.8%. And it then breaks down to the right into cigarettes, e-cigarettes, cigars, smokeless, then pipes. So by far, as you can see, the most popular is cigarettes and e-cigarettes, and then pipes being the lowest. And it's important to note that e-cigarettes popularity has increased very quickly, right? And more likely has gone up even higher in popularity since 2022. We just don't have that information yet. And then the next one here is the current use of tobacco products among adults in the US. And this graph shows the differences from 2019 to 2022. And so what this is exactly showing, at the top, you can see this kind of a breakdown key of the tobacco product use. And that very top line there, we can see that it went down the years 2019, 2020, and 2021, but it has started to rise again in 2022. And you can also see the sudden rise of popularity on this graph a little more clearly here for e-cigarettes between 2020 and 2022. And that's that green line again. It's shot up quite a bit between 2021 and 2022, especially. And so this is essentially showing the same information as the last slide, just in a slightly different way. And the last one, of course, as I mentioned, with the recent rise in popularity and e-cigarette use, I wanted to include this as well, as it focuses on e-cigarette use and cigarette smoking among the e-cigarette user population, and it breaks it down into age group. So it's no surprise that those aged 18 to 24 mainly use e-cigarettes and are 65.5% of the e-cigarette user population. So they are mainly the ones using this device. This is due to how vapes and e-cigarettes are heavily marketed to youth populations and try to get them addicted at a young age. And that population starts to show, as soon as they turn 18. But they were most likely introduced to that product before they were even within that age range. And so now we're going to take a quick look at some disparate populations, and they tend to have higher rates of smoking. So the health impact of tobacco is not evenly distributed. Some groups tend to have much higher rates of tobacco use, lower rates of treatment, and significantly worse health outcomes than the general population. So some of these populations include Native Americans, the LGBTQ plus population, those with mental health conditions, those with substance use disorders, those living with HIV, and then also military service members and veterans. Looking at the LGBTQ plus community, the people within this community experience disparities related to social stigma as well as discrimination. They also tend to have higher rates of tobacco use. They smoke at twice the level of the straight community. Transgender youth have 4 times higher cigarette use and 3 times higher e-cigarette use. These groups are targeted by the tobacco industry. Big Tobacco inspires, brand loyalty through targeted advertising, marketing, and sponsorship of LGBTQ plus events. Tobacco companies target the LGBTQ plus and Black communities to promote menthol cigarettes, which are more popular and highly addictive. And most of this information that I found here, as well as this graphic, was from the Truth Initiative. So absolutely more than welcome. They have lots of great information if you want to look more on that afterwards. And then looking at mental health conditions and behavioral health diagnosis, smoking rates are especially high for people with mental health conditions. 1 out of every 3 adults with a mental health condition is a smoker, as opposed to the general population, it's about 1 in every 5. So that's a big increase. Smoking rates are especially high for people with major depression, PTSD, bipolar disorder, and schizophrenia. Up to 80% of people with schizophrenia use tobacco. Quitting is very challenging, and rates are not going down along with the general population. People with a major mental health issue tend to be people who smoke at a higher frequency. They become very, very heavy tobacco users, and it makes it harder for them to quit, and substantially increases those health risks. Because, of course, the more of the tobacco product we use, the higher the risk. And so, as you can see, there is a strong link between tobacco use and use of other substances. People who use other substances are much more likely to smoke as well. People who smoke are much more likely to use other substances. So it kind of goes back and forth there. People with any substance use disorder use tobacco at rates 5 times higher than those without a substance use disorder. Tobacco users are 4 times more likely to have alcohol use disorder. And 80 to 90% of people with alcohol use disorder are tobacco users. And then lastly, up to 95% of people on methadone treatment are people that also smoke. All right, and so now we're going to be getting into the negative health effects of tobacco and nicotine products. And so I'm going to be starting with the health risk of e-cigarettes and vaping. And I want to start by saying that due to how new these products are, there hasn't been that years and years of extensive research. We haven't had enough time to get really those long-term health effects because they simply just haven't been around long enough. So, of course, as more time passes, there's going to be more research, more findings that go into this, the more longer term health impacts of vaping. And the same goes for, that even newer product, the nicotine pouches. But however, there still has been numerous health risks that have been linked to these products. And so we'll go over those. So in addition to leading the nicotine addiction, vaping can also cause asthma and respiratory distress, cancer, inflammation and permanent scarring in the lungs, headaches, feeling of amplified stress and anxiety, organ damage, cardiovascular issues, e-volley, which stands for e-cigarette or vaping product use associated lung injury. So this e-volley can include cough, shortness of breath, chest pain, fever, vomiting, diarrhea, stomach pain, and rapid heartbeat. And then additionally, there are negative implications to vaping during pregnancy. The nicotine can alter nerve cell functioning during fetal development, and vapes should absolutely not be used during pregnancy. Pregnant people who vape are at a greater risk for stillbirth and preterm delivery. Um, Now looking at the anatomy of cigarette here. And so a cigarette is a highly engineered drug delivery device designed to be addictive by delivering more nicotine. Tobacco companies put additives in tobacco products, so flavors, aromas, and sensations that people find most satisfying. Tobacco plants are genetically altered to double the nicotine content, and there are over 7,000 chemicals in tobacco smoke, including natural tobacco. There are 69 known carcinogens in tobacco smoke. Toxic chemicals and compounds in cigarettes include benzene, nitrosamines, and other volatile compounds like carbon monoxide, tar, and heavy metals like lead, nickel, and cadmium. Then taking a quick look at the health consequences of smokeless tobacco products. Smokeless tobacco products are highly addictive. They contain over 30 carcinogenic compounds. Smokeless tobacco is associated with many health problems, cancer of the mouth, esophagus, and pancreas, and other diseases of the mouth, increased risk of dying from heart disease and stroke. It's not considered a safe alternative to smoking. Smokers who switch to smokeless tobacco usually feel very positive about their accomplishment. And of course, if this does occur, we want to acknowledge that, that effort to stop using, that they stop using the combustible form of tobacco. But we have to realize that the smokeless products can still lead to a lot of the same health risks as well as those oral ones as well. And now we're going to take a look at diseases caused by smoking. Tobacco use was not clearly linked to health risks until the year 1964. In 1964, the first Surgeon General's report on smoking and health linked smoking with lung cancer and heart disease, and that was the first time that ever happened. Many cancers and other chronic diseases are now known to be caused by smoking in the years, since 1964. Tobacco use affects every major system and organ of the body, and understanding the health consequences of smoking has evolved, and tobacco remains the #1 preventable cause of death. And just looking at this graphic here, you can see the list of cancers and chronic diseases, and I'll go over for a few. So cancers, we have oropharynx, larynx, esophagus, trachea, bronchus and lung, acute myeloid leukemia, stomach, liver, pancreas, kidney and ureter, cervix, bladder, and colorectal cancers. And then for those chronic diseases, the list goes on and on. Stroke, blindness, cataracts, And then, I'm not going to go through them all, but you can see the list of the multitude of possible chronic diseases that can occur just from smoking. And then the toll of tobacco, as we mentioned, cancer, there's cardiovascular disease, chronic obstructive pulmonary disease, more commonly referred to as COPD, diabetes, and then pregnancy problems as well. And these four major life-threatening diseases caused by tobacco use. So each year, cigarette smoking causes more than 160,000 deaths from cancer, more than 150,000 deaths from cardiovascular disease, right around 110,000 deaths from respiratory diseases, and more than 9,000 diabetes-related deaths in the US each year. And so smoking tobacco causes almost 9 out of every 10 cases of lung cancer. Smoking also causes cancers of the bladder, blood, cervix, colon, rectum, esophagus, kidneys, liver, mouth, throat, pancreas, and stomach. And so when recovering from cancer, smoking weakens the immune system and interferes with the cancer treatment itself. But the good news is when cancer survivors quit smoking, it can speed the recovery time and lengthens the survival and improves treatment effectiveness of the cancer. It decreases risk of cancer recurrence and decreases the risk of secondary cancer. Challenges for people, who are diagnosed with cancer, of course, could lead to that, guilt, shame, self-judgment, which can make quitting smoking difficult. But as I just mentioned, if they were to stop during that cancer treatment, the benefits are going to be great. And then looking at cardiovascular disease next. Cardiovascular disease is the single largest cause of death in the United States, killing more than 800,000 people a year. Smoking then causes 1/3 of all coronary deaths, so right around 33%. People who smoke fewer than 5 cigarettes a day may show signs of early cardiovascular disease. The risk will then increase with the number of cigarettes smoked per day. Our conversations about stopping smoking, and as I mentioned earlier, of course, if those non-smokers, the risk is going to be lower. And as I mentioned here, fewer than 5 cigarettes a day, they can still show signs of that early cardiovascular disease. And then the more an individual smokes, the greater the risk. And then looking at COPD next. Smoking causes 87% of all lung cancer deaths, and then smoking causes nearly 80% of COPD deaths. So a great amount there. COPD currently has no cure and is the third largest cause of death in the United States. Start to see a trend here, right? We have lung cancer, heart disease, which is the leading cause of death in the US, and then COPD, which is the third largest cause of death. And all of these come back to tobacco use and smoking. And then taking a look at pregnancy. Smoking causes, let me take a look here. So as we can see on the screen here, tobacco and nicotine use during pregnancy, it can cause increased risk of preterm birth and low birth weight. The potential of birth defects can increase by a pretty great amount, and especially in the mouth and lip. Increased risk incidence, of sudden infant death syndrome, more commonly referred to as SIDS. And also, e-cigarettes and other tobacco products containing nicotine are not safe to use during pregnancy and can damage a developing baby's brain and lungs. All tobacco products have oral health consequences. As I mentioned earlier, those smokeless ones just increase the consequences and potential risk of oral health issues, but all tobacco products can cause oral health related problems and issues. Tobacco use causes tooth decay, tooth loss, gum disease, and cancer of the tongue, mouth, and throat. And now we're going to be taking a quick look at secondhand smoke and third-hand smoke. And so exposure to secondhand smoke over time has significant risk for cancer and respiratory problems. Secondhand smoke causes around 34,000 deaths each year from heart disease, and it causes right around 7,300 deaths each year from lung cancer. Secondhand smoke can also increase the risk for sudden infant death syndrome, and children are at an increased risk for secondhand smoke exposure. Secondhand smoke is essentially the smoke produced from that combustible tobacco product. And so, whatever that product may be, the smoke residue that travels through the air afterwards, it can potentially expose all of those people around the tobacco product user. And it exposes them to all of those harsh chemicals that are found within that tobacco product and within the smoke. The exposure occurs essentially by when that others nearby, the individual smoking, just breathe in the smoke, breathe in the air around the person, and they just ingest those harmful chemicals. And it has been found that there is no safe amount of exposure to secondhand smoke. Any exposure is bad exposure. The most common places of exposure can be within homes, places of work, near or in bars, restaurants, casinos, and then also multi-unit housing. Then looking at children specifically, because as I mentioned, they're at a heightened risk for secondhand smoke. This can cause middle ear disease, impaired lung function, lower respiratory illness, and sudden infant death syndrome. In adults, it can cause lung cancer, coronary heart disease, stroke, nasal irritation, and then for those pregnant people, it can cause low birth weight in their child. Now, third-hand smoke. Third-hand smoke is defined as the residue that is left behind from the nicotine and other harmful substances that came from that smoke of the tobacco product, but it absorbed into its environment, its surrounding environment. This can absorb into surfaces, can stick to the walls. It can absorb in your carpet, furniture, your skin, your pet's fur or pet skin, bedding, curtains, so on. Third-hand smoke contains 250 plus harmful chemicals that are found in tobacco product smoke and can stay on these surfaces for years. It doesn't go away with just a simple cleaning or wash. It's extremely difficult to get rid of once it's fully absorbed into these surfaces and furniture pieces. And third-hand smoke is most commonly ingested by, again, children are going to be at a greater risk and the younger populations, but also by pets and anyone in the home, with pets, especially, dogs and cats, because they're on the ground a lot. And since third-hand smoke is embedded into surfaces such as furniture, carpets, curtains, and even pet hair, it can easily get relifted into the air again just by moving about your house or a pet playing or your children playing and just moving things around the house. Those chemicals can get re-released into the air, making it a target for ingestion for anyone that's around. Children are also going to be extra vulnerable because kids have lots of toys. They play with toys, everywhere, indoors, outdoors. Usually spend a lot of time on the ground as well. And if there is third-hand smoke residue in the environment that these kids are playing, indoors at their homes, there's a good chance that it's fallen and absorbed into their toys as well. And babies, toddlers, they like putting things at their mouth into their mouths, as we know, when they're playing, to chew, suck on, whatever it may be. And so with third-hand smoke residue, if it's on these toys, it's going to get directly ingested by these kids playing or putting things into their mouth. Pets can also come into play with children and others in the house, because if they're running around, if it's on their, on their pet fur, they're moving furniture, jumping onto the couch, whatever it may be, that's all going to release these chemicals and third-hand smoke residue back into the air, and it can get ingested by the pet, by the children, by the adults, whoever's in the area. And we're also going to talk a little bit about pets in just a moment too. Third-hand smoke does have many dangers and effects on our health, similarly to secondhand smoke. As we can see, third-hand smoke also increases the risk of developing lung cancer. Third-hand smoke can also damage and break DNA into our bodies. And as we mentioned last slide, children are going to be most at risk for third-hand smoke exposure. And it's extremely difficult, as I mentioned, to completely rid a house or other indoor area of third-hand smoke, like a car. A car is another example. So the danger stays high for third-hand smoke for years and years. Because of this, there's a high exposure risk to the chemicals found in smoke and smoke residue around homes, cars, other smoking locations. And as we talked about earlier with secondhand smoke, third-hand smoke also increases the risk of pneumonia, asthma, ear infections, frequent illnesses, and SIDS. Third-hand smoke can also affect pregnant people by harming the fetus as well. And quickly looking at diabetes here. Smoking causes type 2 diabetes, and smokers are 30 to 40% more likely to develop type 2 diabetes. Smokers are more likely to have trouble with insulin dosing and disease control, and smokers with diabetes are more likely to have serious complications to heart disease, blindness, kidney failure, and nerve and blood vessel damage with the feet and legs. And then I mentioned earlier with pets when it came to third-hand smoke, so I'm just going to touch on that a little pretty quickly here. Starting with children though. So with third-hand smoke in children, it can cause increased asthma and respiratory infections, ear infections, sinus infections, and allergies. And due to third-hand smoke getting embedded in the furniture, carpets, whatever it may be, pets are also at a heightened risk for third-hand smoke exposure due to spending time again, on the floor and furniture. So dogs can actually absorb third-hand smoke residue directly into their skin, but they can also ingest it by toys or just the air surrounding them. And dogs will inhale smoke residue once it's released, back into the air by playing or moving things around, which can then lead to breathing problems, cancer risk, and heightened allergies. Dogs also self-groom, especially with their paws, so this can increase the risk of ingesting these harmful chemicals. And then cats, due to their self-grooming, ingest third-hand smoke residue off of their fur. Cats in homes with indoor smokers have increased nicotine levels in their bodies, and cats also have increased risk in breathing problems, allergies, and cancer development. And does affect other pets as well, but due to the interest of time, I wanted to focus on cats and dogs, as they tend to be the more popular. But there is information on other household pets on how third-hand smoke and second-hand smoke can negatively affect their quality of life. And I feel like this is important to touch on because it goes to show how harmful these chemicals are. So many people have animals and pets, and it does affect them. It might not seem as direct. A lot of people don't kind of seem to put the link together that smoking and secondhand, third-hand smoke can also negatively affect their pets as well. And so just we have a few more minutes here, and I'm just going to be closing it out with some training opportunities and resources, and we'll just go over these rather quickly. So the first thing I have over at ctimaine.org/resources, we have a lot of tools and resources. We have, as you can see on the screen, provider tools, outcome, infographics, fact sheets, patient rack cards, office posters, magnets, stickers that are available to either download or order to get access to for your office, wherever you may want to put them. We have over at ctimaine.org/resources, you can go and find these infographics and products that we do have for you all. There's also some additional at the mainpreventionstore.org. There's some additional resources, posters, infographics, rack cards as well that you're able to order for free. And then lastly, I just wanted to share some of our most commonly used resources here at MaineHealth CTI. These are, you know, the resources that myself as well as my team often go to get all of the most up-to-date and accurate information. And again, you'll be getting a copy of these slides, so no need to write them down as of now, but they are there for you when you get the copy of your slides. And so that does conclude my webinar for today. And again, I would just like to thank you all for being here, being present, and taking in all of this information. I hope each of you were able to learn, something new, or maybe just find some value information, or even a refresher that you can bring to your colleagues or even clients. So again, thank you for all of your time, and also thank you for all of the work that each of you do within this field. And so, Alicia, before we end, I'll hand things back over to you.
Wonderful. Thank you so much, Derek. Lots of great information. There are a few questions in the chat, so I would like to pose those at this time before we close out. So the first one being, which country has the highest prevalence of tobacco smokers?
That is not one I have off the top of my head, unfortunately, but I'd be more than happy to send that along in the summary email. I'll double check. I don't want to say anything incorrect, of course, so I'll get that information. We can send that out in the email.
Absolutely. Yes, any questions that we're unable to get to, we certainly can summarize in that email. The next question is around snus versus Zins. So the question, snus or Zins? Can you speak to that?
Yeah, and so with Zyn, the nicotine pouches, it's really just, it's just a nicotine product, and I understand what you're saying. Zins can be snus and nicotine pouches can be snus, but not all snus are the nicotine pouches and the Zins, because snus can also be a tobacco product as well. It can be both. So the nicotine pouches do technically fall under that category, but it doesn't have the tobacco itself, because some snus products do contain tobacco as well.
Okay, thank you for that, Derek. The next question is, are vaping products regulated online, or is that how the youth easily obtain them?
I wouldn't say that they're fully regulated online. I know one of my colleagues here did a presentation relating that to TikTok and the TikTok shop, where you can order things off of TikTok, being underage, where they essentially buy a product that isn't the vape or isn't the vape product, and it essentially gets packaged with the product and then sent over. And so I definitely would not say it's regulated, especially on TikTok and social media. There's ways to purchase things and kind of get around showing proof of age. Unfortunately, it's a hard one to crack down on.
Yes, agreed. And thank you for recalling. That is also a great webinar, products on the shelves. So thank you for bringing that up. The last question for now is, do we know how long third-hand smoke persists?
And so there's no exact timeline. Of course, if an individual did have third-hand smoke residue, in a home, and they were, cleaning the surfaces, cleaning the products does help, but it by no means gets rid of everything. Some of those really do get embedded depending on the product and the surface, whatever it may be. There are, some of those harsher chemicals, but like your traditional throwing things in the wash and dryer isn't going to fully get rid of them in terms of like clothing, furniture. Um, so it is hard saying, depending on the circumstances, if someone is actively trying to get rid of it, it can go away. But, as an example, if it was just left there, no one really tried to get rid of it, it's going to stay. It's never truly going to go away.
Thanks, Derek. I did have one other question that just came in. That is, what is the difference between a tobacco product and a nicotine product? And can products be classified as both?
Yeah, and so a tobacco product is, looking at the beginning of our webinar, all of those products we went over that contain any source of tobacco, whether it's a cigarettes, chewable product, combustible, non-combustible. If it contains tobacco at some point in it, then it would be considered a tobacco product. And really the ones that differ from just being a nicotine product, like the Zyn pouches, those new nicotine pouches, those don't contain any tobacco. It's more of just as a nicotine product. There are certain vapes that are solely for nicotine, and that's where kind of the two would differ, but there are some e-cigarette and vaping devices that do also contain tobacco. So can be kind of it's a tricky playing field, but there are some that could be qualified as both, but there are different ones as well. I hope that answered your question.
Thank you for that response. Please feel welcome to type any questions in the Q&A. For now, thank you, Derek. This was a very informative webinar. Just to relay that this webinar was recorded, it will be posted to our website. In order to claim CMEs, you must have a profile in Cloud CME. Instructions can be found in the post-webinar email. And for those that are collecting CHES credit, it will be sent to EndCheck after the event. Only those who registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive CMEs and CHES credit, as we are required to verify those who attended. You will also receive this information and a copy of Derek's slide deck in a post-webinar email. Additionally, an evaluation will appear on your screen once the webinar is closed. Please take the time to provide your feedback. And if you have any questions, please feel free to contact us, and we thank you for your participation today.